Hey there and welcome. So, if you're living with a rare anemia, something like sickle cell disease or thalassemia, you've probably wondered, can I still travel? Can I see the world? Well, I've got some great news for you. The answer is absolutely yes. We're about to walk through how, with the right prep, you can travel safely and with total confidence. So let's get into it. I mean, look at this. This is the goal, right? It's not just about getting on a plane, it's about seeing the world feeling prepared, feeling secure. This whole explainer isn't about limitations. It's about empowering you to plan that adventure safely. And this is the big question, isn't it? It's the one that can kind of stop you in your tracks. You see all these amazing travel photos and you just wonder, could that ever be me? Well, the answer is a huge, emphatic no. Travel is 100% not off the table. The trick, and we're going to break this down for you step by step, is all about having the right plan. So where do you even start with a plan like that? It all starts right here. Seriously, before you even think about booking a flight or packing a suitcase, your very first move has to be a good, detailed chat with your doctor. This conversation is the foundation for everything else. And you can't leave it to the last minute. The guideline is to see your doctor at least 6 weeks before you plan to travel. And you might be asking, why so early? Well, it gives you and them plenty of breathing room to assess your fitness to fly, maybe adjust a treatment, and get all the paperwork sorted without any of that last-minute panic. So what do you need to talk about in that appointment? Here are the big four. First, your overall fitness to fly. Then, you'll need to schedule any transfusions around your trip. You'll also confirm you've got the right vaccinations for where you're headed. And, this one's really important, you've got to discuss any recent health issues. For example, if you have SCD, it's a big no-no to travel for at least 10 days after a crisis. Now, here's where it gets interesting. You've got different authorities, like the CAA and IATA, and they actually have slightly different guidelines based on your hemoglobin levels. This right here is exactly why that talk with your doctor is so critical. They're going to make a call based on you and your specific situation, not just some generic number on a chart. All right, so you've gotten the green light from your doctor. Awesome. Now it's time to get into the nitty-gritty of planning. Let's call this our pre-travel checklist, where we get all our ducks in a row. We can break this whole thing down into 5 simple, totally manageable steps. First, we'll gather the paperwork. Then, organize your meds. Third, double-check vaccinations. Fourth, sort out your insurance. And last but not least, pack smart. Let's tackle them one by one. Okay, paperwork. Think of this stuff as your travel safety net. You're going to want a medical report from your doctor that explains your condition and treatment, copies of your prescriptions, your doctor's contact info, your vaccination record, and definitely your travel insurance documents. Having this little folder with you could be an absolute lifesaver. Okay, listen up, because this next one is probably the most important tip in this whole explainer. That's why it's in all caps. Every single one of your medicines must go in your carry-on bag. No exceptions. Check bags get lost, they get delayed, and you just can't take the risk of being separated from your essential medication. This is totally non-negotiable. And building right on top of that, always pack more medication than you think you need. Just think about it for a second. A flight gets delayed, you miss a connection, you drop a bottle of pills. Life happens. That extra supply is your safety cushion. It's going to give you so much peace of mind. And packing smart isn't just about your meds. It also means thinking about other health essentials. Like if you have sickle cell disease, oral rehydration salts are a must-have to help prevent a crisis. Or, depending on your destination, a really good insect repellent and a mosquito net could be just as important for staying healthy. So you're all packed up, you're ready to go. Now let's talk about the actual journey. Keeping yourself healthy and feeling good while you're on the move. At the airport, on the plane, that's the next piece of the puzzle. A little heads up goes a long way. Make sure to call your airline well before your flight. Let them know about your medical condition, tell them you'll be carrying medications, or let them know if you might need something like in-flight oxygen. It just prevents any surprises or hassles when you get to the airport. This is such a great, simple breakdown for staying well on a long flight. On the do side, it's pretty simple but super effective. Drink lots of water, get up and stretch your legs every half hour or so, and wear warm, comfy layers because those cabins can get chilly. And what to avoid? Alcohol, it'll just dehydrate you, and sitting still for way too long, which is a risk for blood clots.
Phew, we've covered a lot of ground, right? So let's boil it all down to a few simple golden rules that you can easily remember. These are really the heart of what makes for a safe and amazing trip.
When you get right down to it, it's all about these three things. Number one, plan early. That 6-week chat with your doctor is your starting line. Number two, communicate. Give your airline a heads up about your needs. And number three, carry your records. Keep all that important paperwork with you in your hand luggage. If you can master these three, you are well on your way to a fantastic trip. And that brings us to our final thought, and honestly, it might be the most important one. Everything we talked about today, these are fantastic guidelines, but, and this is a big but, every single airline has its own specific set of rules and medical standards. So, after you have talked to your doctor, what's the very next thing you do? Go to the airline's website or give them a call and check their regulations directly. Your health is priority number one, and being prepared is what unlocks the world for you. Safe travels.